friends, I'm Dr. Hemant. I work as an orthopedic surgeon. I'm working as a chairman orthopedics in Marengo Asia Hospital, Gurugram. So today I'll be telling you about a knee replacement, little bit about the implants. First of all, knee is for life. So of course, if doctor would have done an examination, x-rays, and you actually require a knee replacement, it has been decided, right? Now people come to me and ask me implant. Remember one thing, all the good quality implants have got a lot of research and backing. These implants can be either made in America or Germany or England. They have got a research and we have got a data. There are many companies. I always tell my patients that it is so difficult to pick and choose between some good cars like Porsche, BMW, Mercedes, Audis, Maseratis and things like that. Similarly, we have implants which is Stryker, Johnson, Smith & Nephew, Zimmer. All these implants are available freely worldwide. So if you go to someone and tell them that I've had a Stryker knee, anyone will understand that. I think I don't want to publicize, but it's just like an iPhone or a Samsung. If you're having it, no matter whichever part of the world you go, people will know, yes, we have heard about this. So implant is one of the factors because a lot of research has gone. Most important is choose your doctor. Doctor who has a good training, good experience, and also doctor who is able to manage complication. So there are many people who can do a knee replacement surgery, but when something goes wrong, a good doctor will be able to sort that out either during the operation or if it occurs after the operation. So next thing is the alignment. Nowadays with the robotic surgery, we are able to offer you functional alignment. Functional alignment is something which is like a natural alignment which nature has given us. In any knee replacement, we are making the knees completely straight. And so around 20% of people or 18% of people feel this is not a natural knee. We feel slightly different. Here comes the newer role of robotics where we are giving your knee slight angle of around 3 degrees which nature has given us. So a lot of research are going on. Yes, it is very accurate and precise. And remember, robot is just my servant. I am doing the surgery. I decide what to do, how to cut, where to cut. Robot is just a tool which helps me in cutting very precisely. Thank you. And recovery for knee replacement surgery on an average takes 3 to 5 months duration. Thank you very much.